Good morning everyone. I am Norhaina Salazar from Go5 and my topic for my report is all about problem employees. Transferring the problem employee. So first, let's define what is a transfer. A transfer may be defined as a reassignment to another job within the organization. In a strict business sense, a transfer usually implies similar pay, status, and responsibility. Because of the variety of positions available for nurses in any healthcare organizations, coupled with the lack of sufficient higher-level position available, two additional terms have come into use: the lateral transfer and the downward transfer. So what is a lateral transfer? Lateral transfer describes one staff person moving to another unit to a position with a similar scope of responsibilities within the same organization. A downward transfer occurs when someone takes a position within the organization that is below his or her previous level. It may be in nurses' interest to consider a downward transfer because it can increase the chances of long-term career success. So an example of lateral transfer is an accountant 2 at 7th pay grade and they post for position of financial analyst 1, which is also pay grade 7. One of the example of transfer lateral. So in a downward transfers also should be considered when someone are experiencing periods of stress or overload. Self-aware nurses often request such transfers. In such circumstances, the manager may need to intervene and use a downward transfer to alleviate temporarily a nurse's overwhelming stress. Another type of downward transfer may accommodate employees in the later stage of their career. In many cases, valid employees who wish to reduce their career rules may be accommodated by manager assistants with locating a suitable position for their talent and stature in the profession. So para mas maintindihan natin, ang downward transfers is the voluntary movement of any employee from one position level to another position level which the minimum rate of pay is lower. Grievance procedure. Growth can only occur when employees perceive that feedback and discipline are fair and just. When employees and managers perceive fair and just differently, the discrepancy can usually be resolved by a more formal means called a grievance procedure. The grievance procedure is essentially a statement of a wrongdoing or a procedure to follow when one believes that a wrong has been committed. This procedure is not limited to resolving disciplinary discrepancies. Employees can use it anytime they believe that they have not been treated fairly by management. This chapter, however, focuses specifically on grievances that result from the disciplinary process. Most grievances or conflict between employees and management can be resolved informally through communication, negotiation, compromise, and collaboration. Generally, even informal resolution has well-defined steps that should be followed. Formal process. In the employee and management cannot resolve the difference informally, a formal grievance process begins. The steps of the formal grievance process are generally outlined in all non-union contracts or administrative policy and procedure manuals. Generally, these steps include the progressive lodging of formal compliance up the chain of command. If resolution does not occur at any of these levels, a formal hearing is usually held. A group of people is impaneled much in the same way as a jury to make a determination of what should be done. Such groups are often at risk for favoring the individual employee over the all-powerful institution. The tendency reinforces the need for the managers to have clear, objective, and comprehensive written records regarding the problem employees' behavior and attempts to cancel. Arbitration. If the differences cannot be settled through a formal grievance processes, the matter may finally be resolved in a process known as arbitration. In arbitration, both sides agree in the selection of a professional mediator who will review the grievance, complete fact-finding, and interview witness before coming into a decision. So an example of arbitration is when two people who are divorcing cannot agree on terms and allow a third party to come in to help them negotiate. Right and responsibility in grievance resolution. Employee and managers have some separate and distinct rights and responsibilities in grievance resolution, but many rights and responsibilities overlap. Although it is easy to be drawn into emotionalism of a grievance that focuses on one's perceived rights, the manager and employees must remember that they both have rights and that these rights have concomitant responsibilities. Disciplining the unionized employee. It is essential that all managers be fair and consistent in disciplining employees, regardless of whether a union is present. The presence of a union does, however, usually entail more procedural, legalistic safeguards in administering discipline and a well-defined grievance process for employees who believe that they have been disciplined unfairly. Usually, the manager of non-unionized employee has greater latitude in selecting which disciplinary measure is appropriate for a specific infraction. On the other hand, unionized employees generally must be disciplined according to specific, pre-established steps and penalties within an established time frame. For example, the union contract may be very clear that excessive unexcused presence from work must be disciplined first by a written reprimand, then a 3-day work suspension, and then termination. This type of discipline structure is generally fairer to the employee but allows the manager less flexibility in evaluating each case's extenuating circumstances. Another aspect of discipline that may differ between an unionized and non-unionized employee is the following: the due process and the burden of proof. The due process means that management must be provide union employees with a written statement outlining disciplinary charges, the resulting penalty, and the reasons for the penalty. Employees then have the right to defend themselves against such charges and to settle any disagreement through formal grievance hearings. The burden of proof. The burden of proof, which typically is the responsibility of the employee without union membership but is the responsibility of the manager of the employee who belongs to a union. This means that managers who discipline union employees must keep detailed records regarding misconduct and canceling attempts. The marginal employee. The term marginal is reserved for an employee who has consistently poor attitude or performance record. The marginal are another type of problem employees. However, traditional discipline is generally not constructed in modifying their behavior. This is because marginal employees often make tremendous efforts to meet competencies, yet usually manage to meet only minimal standard at best. All organizations have at least a few such employees. Managing these employees then is often a frustrating and tiring task. So how do we handle a marginal employee? Recognize good performance. Recognizing marginal employees when they do something correctly is another way of clarifying expectations and providing positive reinforcement. Recognizing good performance increases the likelihood that employees will repeat the performance. The chemically impaired employee. Substance misuse involves maladaptive patterns of psychoactive substance abuse, with the substance user continuing use in the face of recurrent occupational, social, psychological, or physical problems and/or dangerous situations. If effective management demands that the organization takes an active role in ensuring patient safety by immediately removing these employees from the work setting. However, managers also have responsibility to help these employees deal with their disease so that they can return to the workforce in the future as productive employees. In chemically impaired employees, there are characteristic changes. Changes in personality or behaviors, changes in job performance, changes in attendance and use of time. Example of changes in personality or behaviors: increased irritability with patients and co-workers by extreme calm. Versus social isolation, eats alone, avoids unit social functions. Versus extreme and rapid mood swings, usually strong interest in narcotics or the narcotic cabinet. Versus the sudden dramatic change in personal grooming or any other area. forgetfulness ranging from simple short-term memory loss to blackouts. In changes in job performance, there's a difficulty meeting schedules and deadlines. Frequently volunteers to be medication nurse and has a higher number of assigned patients who complain that their pain medication is ineffective in relieving their pain. Consistently meeting work performance requirements at minimal levels or doing the minimum amount of work necessary. In changes in attendance and use of time, example, increasingly absence from work without adequate explanation or notification, most frequent absence on Monday or Friday, long lunch hours, excessive use of sick leave or requests for sick leave after days off, frequent calling in to request compensatory time, arriving at work early or staying late for no apparent reason, consistent lateness, frequent disappearance from the unit without explanation. Confronting the chemically impaired employee. The first step in dealing with the chemically impaired employee actually occurs before the computation process. In the data or evidence gathering phase, the manager collects as much hard evidence as possible to document suspicious of chemical impairment in the employee. All behavior, work performance, and time and attendance changes presented in the displays in this chapter should be noted objectively and recorded in writing. If possible, a second person should be asked to validate the manager's observations. In suspected drug addiction, the manager also be examined until narcotic records for inconsistencies and check to see that the amount of narcotic the nurse signed out for each patient is the same as the amount ordered for the patient. Because few nurses drink alcohol while on duty, managers have to observe for more types too, such as the smell of alcohol on the employee's breath. If the organization's policy allows for it, the manager may wish to require an employee suspected of chemical impairment to undergo immediate drug or alcohol testing. If the employee refuses to cooperate, the organization's policy for documenting and reporting this incident should be followed. If at any time the manager suspects that an employee is chemically influenced and thus present a potential hazard to patient safety, the employee must be immediately removed from the work environment. The manager should decisively and unemotionally tell the employee that he or she will not be allowed to return to the work area because of the manager's perceptions that the employee is chemically impaired. The manager should arrange for the employee to be taken home so that he or she does not drive while impaired. A formal meeting to discuss this incident should be scheduled within the next 24 hours. This type of direct confrontation between the manager and the employee is the second phase in dealing with the employee suspected of chemical impairment. Of course, in confrontation, there's a denial and anger. If the employee denies having a problem, documented evidence demonstrating a decline in our work performance should be shared. The manager must be careful to keep the confrontation focused on the employee's performance deficits and not allow the discussion to be directed to the cause of the underlying problem or addiction. These are issues and concerns that the manager is unable to address. The manager also must be careful not to preach, moralize, scold, or blame. The manager's role in assisting the chemically impaired employee. The manager must be careful not to assume the role of counselor or treatment provider for the impaired nurse. The manager also must be careful not to feel the need to diagnose the cause of the chemical addiction or to justify its existence. Protecting patients must be the top priority, taking precedence over any tendency to protect or excuse subordinates. The manager's role is to clearly identify performance expectations for the employee and to confront the employee when those expectations are not met. The manager can play a vital role in creating an environment that decreases the chances of chemical impairment in the work setting. This must be done by controlling or reducing work-related stressors whenever possible and by providing mechanisms for employee stress management. The manager also should control drug accessibility by implementing, enforcing, and monitoring policies and procedures related to medication distribution. Finally, the manager should provide opportunities for the staff to learn about substance abuse, its detection, and available resources to help those who are impaired. The recovery process. In the recovery process, there's a first phase, second phase, third phase, and last phase. In the first phase, the impaired employee continues to deny the significance or severity of the chemical impairment but does reduce or suspend chemical use to appease family, peers, or managers. These employees hope to re-establish their substance abuse in the future. In the second phase, as denial subsides, the impaired employee begins to see that the chemical addiction is having a negative impact on his or her life and begins to want to change. Frequently, people in this phase are buoyant with hope and commitment but lack maturity about the struggles they will face. This phase generally lasts for about 3 months. During the third phase, the person examines his or her values and coping skills and works to develop more effective coping skills. Frequently, this is done by aligning himself or herself with support groups that reinforce a chemical-free lifestyle. In this stage, the person realizes how sick or she was in the active stage of the disease and is often fraught with feelings of humiliation and shame. In the last phase, people gain self-awareness regarding why they become chemically addicted and they develop coping skills that will help them deal more effectively with stressors. As a result of this, self-awareness, self-esteem, and self-respect increase. When this happens, the person can decide consciously whether he or she wishes to or should return to the workplace. The chemically impaired employees re-enter to the workplace. Because chemically impaired nurses recover at varying rates, predicting how long this process will take is difficult. Again, although managers must show a genuine personal interest in their employees' rehabilitations, their primary role is to be sure that employee understands the organization's right to insist on unimpaired performance in the workplace. So, the following are generally accepted re-entry guidance for the recovering nurses. No psychoactive drug use will be tolerated. The employee should be assigned to day shift for the first year. The employee should be paired with successfully recovering nurse whenever possible. The employee should be willing to consent to random urine screening with toxicology or alcohol screens. The employee must give evidence of continuing involvement with support groups such as Alcoholics Anonymous and Narcotics Anonymous. Employees should be encouraged to attend meetings several times each week. Integrating leadership roles and management function when dealing with problem employee. Constructive discipline then requires leadership and management skills. In administering discipline, the leader actively shapes group norms and promotes self-discipline. The leader also is a supporter, motivator, enabler, and coach. The humanistic attributes of the leadership roles make employees want to follow the rules of the leader and thus the organization. In dealing with the employee with special needs, the marginal employee, those who are psychological or chemically impaired, the leader serves more as a coach and resource person than as a counselor, disciplinarian, or authority figure. The manager's primary obligation is to see that patient safety is assured and that productivity is adequate to meet unit goals. The manager uses the authority inherent in his or her position to provide positive and negative sanctions for employee behavior in an effort to meet those goals. The effective leader manager blends this unit productivity needs and human resource needs. However, selecting and implementing appropriate strategies to meet both goals is difficult. The leader manager believes that each employee has the potential to be successful and valuable member of the unit and intervenes accordingly to meet each employee's special needs. That's the end of my report. Thank you everyone and good morning.